So in this small video, it's about the gross specimen of hand, and here I'm going to show you the structures passing below the flexor retinaculum at the wrist, and this video will also include a small description about DUPUYTRENS contracture. Okay. Okay, now I'm going to tell you about the flexor side. Flexor side of flexor compartment, the forearm, the flexor retinaculum, and palmar surface of the hand. Both, all these specimens you can see they're all at the left side. So here, when you come to identify the structure, let the examiner ask like which structure is this, which tendon is this, right? So one thing is like first of all focus upon the wrist. There's a retinaculum which has not been dissected out in this. So if it's not been dissected out, as I told you, this was a transverse band attached to the on the ulnar side to the pisiform, to the hook of Hammond, and there is a tubercle of scaphoid, and to the crest of trapezium. So the four pillars onto which this flexor retinaculum is attached. And remember the stretches, there are stretches passing below to this, there are stretches passing superficial to this. So if you find a tendon, like you can see here that this tendon is passing superficially, right? If this tendon is passing superficially to the retinaculum, then it will be, you can see it here also in this specimen also. This tendon, if they ask, like all of the rest of the tendons, they're passing below the retinaculum, but this one is superficial. So a tendon passing superficial to the retinaculum will be Palmaris longus. Palmaris longus is merely a vestigial muscle. So this tendon actually, you can see it expands and merges with a deep fascia in the palm, and so it's a triangular expanded aponeurosis of this palmaris longus. That's called Palmar aponeurosis, right? And Palmar aponeurosis, remember that if it's like there is sometimes constriction, shrinking of this idiopathic cause, that it shrinks on this ulnar side, and because of this constriction of this Palmar aponeurosis, what happens is your ring finger gets flexed like all the time, and that's DUPUYTRENS contracture. Okay, so now about identifying the rest of the tendons. If you find a tendon, like first of all, make sure you identify this big tendon. When you find a big tendon which has like 4 subparts, so this will be flexor digitorum superficialis. This is flexor digitorum superficialis, right? And this is flexor digitorum superficialis, one thing, right? And very easily identify the structure just below to this flexor digitorum superficialis on the radial side. This will be a nerve which is passing below to the retinaculum. Which nerve is this? Very easy, because it's a content of carpal tunnel. So this will be median nerve. Got it? So this is median nerve, and there is a tendon passing from the towards the radial side below the retinaculum. This will be flexor pollicis longus, and 4 tendons of the superficialis. Okay, Palmaris longus was this superficially, we have removed this. Then contents of the carpal tunnel, remember there were 10 structures. Basically there was this 4 tendons of flexor digitorum superficialis, flexor pollicis longus on the radial side. In between here you have this radial nerve, and down below you can see is a big deep muscle which is glistening tendons. This is flexor digitorum profundus, and remember it's a hybrid muscle having dual nerve supply from both ulnar nerve and median nerve. The 2 tendons from the index and middle is for by radial nerve. The tendons from ring and little finger is by ulnar nerve. Okay, so that was then what else passes through the flexor retinaculum? There's an artery also. Remember, the deepest structure of the palm, if they ask, is deep palmar arch. If they ask what is the most superficial structure in the palm, after reflecting this palmar aponeurosis, the most superficial structure that you'll find will be superficial palmar arch. Superficial palmar arch is the continuation of ulnar artery. Deep palmar arch is the continuation of radial artery. What will be the surface anatomy for superficial palmar arch? Superficial palmar arch, the surface anatomy is very easy. You just need to flex your thumb like this. When you flex your thumb with a pen or a pencil, you can draw an arc like here. So that will be the surface anatomy of the superficial palmar arch that will pass at the level of the neck of the metacarpals. This was asked in the NEET PG exam sometime. Then deepest structure, I told you, is the deep palmar arch, continuation of the radial artery, and that also rests, remember, doesn't rest over the carpals, it also rests over the metacarpals and at the base of the metacarpals. Superficial at the level of neck of metacarpals, deep palmar arch at the level of base of the metacarpals. So that was just a few important points which I can revise, make you learn, because sometimes in MCQs, you people are getting MCQs also in your exams. So that's why I'm covering the all important points. So yeah, I was telling that below to this retinaculum there is a artery. Now this is actually a recurrent artery. So the deep palmar arch gives a recurrent carpal branch. So from the deep palmar arch there's an artery running back into the forearm below to the retinaculum, and that is called the recurrent carpal branch from the deep palmar arch. Got it? So there's an artery also. And what lies below to this, if I'm not reflecting it because it's not properly dissected, if you reflect the flexor digitorum profundus, right, deep below to that you find another deep muscle, that is a quadrangular muscle here connecting both radius and ulna, and that is pronator quadratus. Now if they ask what is the space down below this profundus and retinaculum, flexor digitorum profundus and pronator quadratus, the space is called forearm space of parona. Okay, so yes, now about important thing is there is one more tendon here, and that is flexor carpi radialis. Flexor carpi radialis, if they ask, so remember that flexor carpi radialis is a separated out thing, and flexor carpi radialis is not a content of carpal. This flexor retinaculum on the radial side has a deeper slit, so as to separate this tendon of flexor carpi radialis, right? So, and that is attached to the medial crest of trapezium. So that, you know, flexor carpi radialis, it grooves this trapezium here, and it overlies to the trapezium. So it is being separated out by the deeper slip of flexor retinaculum. So it's not a content of carpal tunnel, one thing. Then on the ulnar side, this retinaculum gives a superficial slip, and that is volar carpal ligament, and that is attached to the pisiform. So below to this volar carpal ligament, there is a space created, and it's called Guyon's canal. Right? So what passes through the Guyon's canal? There will be ulnar artery and ulnar nerve. N for nerve, N for nearer to pisiform. A for artery, A for away from the pisiform. Right? So here in this specimen, if you can see here, I'm talking about this flexor carpi ulnaris. Right? So this muscle is flexor carpi ulnaris. Right? So if you reflect flexor carpi ulnaris, down below what you find, very easy to identify, this will be ulnar nerve. Got it? So if they ask, okay, show me where is the ulnar nerve, you just have to find out flexor carpi ulnaris, you know, just reflect it deep below to this flexor carpi ulnaris, you will find a nerve, and that is ulnar nerve. And as I told you, it will be accompanied by an artery, and that will be ulnar artery. Can you see it? That this nerve also has an artery running together, right? This also has an artery running together. The nerve and artery together, they are running here like this. And as I told you, N for nerve, N for nearer to pisiform. That is just to make you learn that if it's asked which is medial structure, ulnar nerve or ulnar artery. So nerve will be medial, artery will be lateral. And here you can see also that the nerve is medial and the artery is towards the thumb, so it is lateral. Got it? Median nerve I already showed you. Then if it's asked to show the radial nerve or the radial artery, so remember, both the radial nerve and artery, they are running under the cover of brachioradialis. So if you see this muscle, remember brachioradialis is attached to the styloid process, the radius. So the lateral most running muscle, right, coming from the lateral supracondylar ridge of the humerus. So this is brachioradialis. So when you reflect brachioradialis, you will find, look, I'm showing it here. This specimen has a lot many good features also. You can, these can be asked, like this is the flexor, this muscle running lateral most is, right? So this is not a content of, this muscle is not reaching nowhere related to this retinaculum, neither flexor, neither extensor. Got it? It's only, it's a laterally placed muscle in the forearm. It actually is, analogous to the lateral compartment of the leg. There you have peroneus, longus and brevis. Here you have only this muscle brachioradialis, which is somewhat homologous to the lateral compartment of the leg. And here you have brachioradialis. Now under the cover of brachioradialis, can you easily see when I'm turning it like this side, under to this you are finding this nerve running. Easy now. So this will be, when I'm pulling it out like this you see is radial nerve, and when I'm pulling it, you can see that this thing is being pulled, right? So yeah, this is radial nerve, the superficial branch of radial nerve. Got it? So superficial branch of radial nerve, as I already told you, it passes through the anatomical skin box and supplies the skin on the lateral half of the dorsum of hand. Deep branch of radial nerve was also called posterior introsseous nerve of back of forearm. Okay, so radial nerve and radial artery. Radial artery भी है भाई इसमें तो, lateral artery, radial nerve, both of them are here. Now radial artery, radial nerve, अगर ऐसे ही आप देखो इसके anatomical position में, so remember दोनों nerves जो है, right, both the nerves, radial nerve, ulnar nerve, they are running peripherally. Arteries, both the arteries, radial artery, ulnar artery, they are running in the center. Means, if, as I told you, just remember the mnemonic, N for nerve, N for nearer to the PC form. So ulnar nerve is medial, ulnar artery is lateral. Now remember, as I told you, दो चिमटे हैं ना ऐसे, nerves का ये वाला है, arteries का ये वाला है, ठीक? तो radial nerve will be lateral, radial artery will be medial. Got it? So here, when I am reflecting this brachioradialis, you finding is radial nerve and which is lateral, and उसके साथ में just along with that you seeing is radial artery. So radial nerve, radial artery, both of them you'll find here. The artery will be medial, nerve will be lateral. So that was about the structures. The front of wrist passing to the retinaculum.